But if I could have your attention, I would just like to introduce our luncheon keynote speaker. Julie Rovner's here today, and Julie is a health policy journalist who's covered Capitol Hill since 1986. She's a health policy correspondent for National Public Radio, and I know Julie has lots of fans in the Mid-Missouri area. And she's a special correspondent for National Journal's Congress Daily. In her past, she's done lots of good work. She's an award-winning journalist and a noted expert on health policy issues. She's appeared on CNN, C-SPAN, MSNBC, the PBS McNeil-Lehrer NewsHour, and now with Bill Moyers. Her articles have been in dozens of national newspapers and magazines, including The Washington Post and USA Today, and she has an award-winning reference book called Healthcare Politics and Policy A to Z that's in its second edition. She also contributed to the book in 1995 called Intensive Care, How Congress Shapes Health Policy, which many of you are familiar with. So I'm just delighted to have Julie Rovner here to say a few words about what's going on the national level.
I actually come with breaking news from my BlackBerry. Apparently, Louis Libby has resigned. I offer that up only as breaking news, and the press conference isn't until 2, or I guess 1 Central Time. No, it's at 2. No, yeah, that's true. I was talking last night about how bad news always comes out at 5 o'clock on Fridays. That tends to be in this case. But see, in this case, the person who's making news actually wants to make news, so he's going to do it at 2 o'clock on Friday. In any case, I didn't mean to trump myself. But I'm a journalist. I have to share information when I get it. So thank you for inviting me here to the Heartland, or what many in Washington refer to as Flyover America. I come from the nation's capital with good news and bad news. The good news is that healthcare is, again, rising in importance on the national agenda. Many, the big deep thinkers and pollsters think that perhaps in the next election, and certainly in the next presidential election, healthcare will once again be among the top issues, if not the #1 issue. The bad news, though, is, as usual, healthcare is rising in importance at the exact moment Washington is out of money. Of course, rising healthcare costs are a major part of the reason that Washington is out of money, but the first rule to remember inside the Beltway: abandon logic, all ye who enter here. Lest you need a little bit of evidence, look no further than the floor of the U.S. Senate. This week, the Senate's been debating the $600 billion appropriation for the Departments of Labor, Education, and Health and Human Services. That's billion with a B. Actually, to be precise, it's $604,436,313,000, or at least it was when I left. I think it grew a little bit last night. Most of you probably know this, but for those who don't, this is the bill that funds some of the most recognizable health and welfare programs in the federal government: National Institutes of Health, Centers for Disease Control and Prevention, Head Start, and community health centers, just to name a few. And floor debate on the bill, particularly in the Senate, is the time and place for senators to debate important health care policy issues of the day. So on Wednesday, in one of those important health care issues, Oklahoma Senator Tom Coburn offered an amendment to bar $1 million, that's million with an M, in funding for HIV Vaccine Awareness Day. Now, this is a program sponsored by the National Institute of Allergy and Infectious Disease to, and I quote, recognize and thank the thousands of volunteers, community members, health professionals, and scientists who are working together to find a safe and effective HIV vaccine. Senator Coburn's reasoning in trying to cancel the program is that federal money spent on an HIV vaccine should be spent on research, not on awareness. Fair enough. But is this really a matter of major health policy import that merits floor debate in the Senate? You can judge. Meanwhile, committees in the House and Senate this week are writing what's called their budget reconciliation bills. These are bills that are ordered by the annual budget resolution to reduce spending on what we call mandatory programs, which don't get funded through the regular appropriations process. So this is in addition to the $600 billion. Don't worry if you don't understand this process. I think about half the members of Congress don't understand it either. Anyway, lawmakers are meeting those savings requirements largely by cutting spending on programs for the poor: Medicaid, food stamps, child support enforcement, and foster care, to name a few. That's mostly because most mandatory spending, aside from sacrosanct Medicare and Social Security, are programs that help the poor. And because the only other way to lower the federal deficit besides cutting spending is to raise taxes, that's something it's pretty safe to say isn't going to happen this year. Now, cutting programs for the poor, even in ways that wouldn't directly affect them, like going after fraud and abuse, was still pretty controversial last spring when moderate Republicans in particular balked at cutting Medicaid while increasing tax cuts for the wealthy. Then came Hurricane Katrina, which brought back to public attention in a very powerful way the plight of the poor and underserved. Congress immediately appropriated $80 billion for the relief and rebuilding effort. And if you were a logical person, you might think that it would find programs other than those aimed at the poor to meet its budget targets. But this is Washington, so you'd be wrong. In fact, conservatives in the House, aghast at all the spending and the ballooning deficit, decided that budget-cutting targets should be made bigger, not smaller, cutting $50 billion over the next 5 years instead of the $35 billion the House and Senate agreed to last spring. And those conservatives took straight aim at programs for the poor. Because they say they're not working, if they were, then we wouldn't have any more poor people. You laugh, I have the tape. Unfortunately for those conservatives, however, there has turned out not to be a majority, even in the Republican-dominated House, to boost the cutting total. So that means the target would still be $35 billion, right? Not quite. House leaders, despite not being able to actually muster the votes to change the budget resolution, have ordered committee leaders to cut more anyway, and that's precisely what's going on now. Now, in fairness to the conservatives, these cuts aren't as draconian as they've been portrayed. Medicaid costs the federal government, this is just the federal part, roughly $180 billion a year, or not counting inflation, a little over $900 billion over the next 5 years. So reducing spending by $10 billion over that time won't exactly bankrupt the program. Someone did the math at one point, it's like 0.17%. But as you know, facts in Washington aren't what they are, they're what they're made to appear to be. Which is why you see people screaming and yelling about cutting Medicaid. And it's true that Medicaid is mostly on the front burner at the moment, with the states and the federal government mostly doing what I call playing hot potato, each trying to pass more costs off to the other. But that's not to say that Washington can't multitask, which brings us to Medicare, or more specifically, Medicare's new drug benefit, Part D. Republicans have a lot riding on the success of Part D, since the 2003 Medicare law passed with primarily Republican support. So you'd think that Republicans would be doing everything they possibly can to smooth the transition. Not exactly. Since the law was passed, Republicans have refused the chance to dramatically increase funding for the senior counseling programs that will help beneficiaries sort out what's turned out to be dozens of options in every state. One counselor I talked to this week has 2 staffers and 25 volunteers to help 116,000 beneficiaries in her county. If you assume that counseling will take a half hour per beneficiary, which is pretty optimistic, and if I did the math right, which is probably a bigger question, that would mean each person would need more than 2,000 hours to serve everyone, or roughly 12 weeks with no time to eat or sleep. And just this last Tuesday, Republicans turned back an effort to let Medicaid continue to temporarily pay the drug bills for those 6.4 million dual eligibles who get Medicare and Medicaid, even though the change would have saved $100 million and avoided the possibility that these duals will find themselves unable to figure out how to get their medicines come January 1st. On the other hand, the Democrats who offered the amendment couldn't seem to explain it, which is probably why it failed. Now, I don't mean to make Congress look totally incompetent. In fact, there are a lot of very smart, very serious, very hard-working legislators in Washington from both parties who are trying very hard to make a difference when it comes to health care. So why don't they make more of a difference? Well, in a nutshell, ideology. Even if we all agree that the nation's health care system pretty much stinks as it is now, no one agrees on which direction would fix it, more government or less government intervention. Conservatives largely think that government is the problem, that if there were less government interference in the free market health care, it would be better and cheaper, as we've seen with cars and computers and other types of consumer products. Liberals mostly think the free market can't work when it comes to health care, since after all, most people don't prescribe their own health care, doctors do. And if it weren't for Medicare and Medicaid, we'd have 150 million uninsured Americans, not just 46 million. That leaves moderates in both parties, a dwindling group, I might add, as the country gets more blue and red and less purple, who hold the balance of power. And when it comes to health care, the moderates are interested, but they can't seem to make up their minds either, other than to say that we need more embryonic stem cell research and to be able to import drugs from Canada. Now, that's not to say that Congress can't accomplish anything important on health care. Official Washington is working very hard and in a bipartisan way on standards to create an interoperable health care information technology system, which will be no small achievement when it gets done, assuming it gets done. And while very few people were actually paying attention this past summer, Congress passed and President Bush signed a bill to create a voluntary system for reporting medical errors and near misses, something it's been vowing to do only since the Institute of Medicine issued its report in 1998. Well, better late than never. But it's really not fair to blame Congress and the administration for what ails the nation's health care system. The bottom line is that our system, or lack thereof, is our own fault. About a third of us want a Canadian-style single-payer system. About a third want health savings accounts or more consumer-directed free market care. And about a third want some sort of hybrid. The last time I checked, that did not a majority make for anything. And to quote the esteemed health economist Stuart Altman, the status quo is everyone's second choice, leaving us basically where we are today. So when will the health system actually get fixed? Only when we demand that it happen, and that when we agree on how. And I leave that task to people like you, and when you figure it out, would you please let me know? And I'm happy to take questions if you...
Any questions for Ms. Rovner?
How do people in Washington feel about the head of the Senate, Bill Frist, being kin to the Health Corporation of America and trading stocks apparently illegally?
Yes. The question is, how do people in Washington feel about the allegations about Bill Frist, whose family founded and still heads to some extent the Hospital Corporation of America, apparently trading stocks in a trust that was not so blind as he thought it was. That's obviously still being investigated. I think it's fair to say that the Republicans in Washington are in a bit of disarray at the moment, with Tom DeLay having been forced to step aside and Senator Frist under investigation, and now what's going on in the White House, which sort of adds another air of, is anything going to get done on anything in the next few months? I think it's just sort of part of the disarray, and I think we have more disarray than usual because they're very late with a lot of the budget process. This is very unusual for the appropriations to be, passed this late in the year. The fiscal year started October 1st. They were supposed to do these budget reconciliation bills in September, but when they got back right after Labor Day, which was right after Katrina, they thought, the favorite phrase was, they didn't like the optics of cutting programs for the poor right after Hurricane Katrina, so they put it off for a month.
With the Medicare Part D program and the relationship between the federal and state governments, I know some states, and Missouri is one of them, that it's going to have what they call a clawback, where it's going to cost Missouri more money as far as getting prescription drugs to Medicaid dual eligibles. What's happening on the federal level with those states, such as Missouri, that are going to be paying more?
The question is about the clawback, and indeed there seems to be a number of states where, even though the clawback was set up so that states would get more money from giving over the drug costs of the dual eligibles to the federal government, but they would give back the windfall. That was the theory behind it. It's turned out, I think, that the way it's going to work, a lot of states will end up losing money. There's a couple of states who've been threatening to sue, and I'm waiting for somebody to sue. In fact, I think Rick Perry in Texas is one of those who's threatening to sue. In the meantime, the governors have not really been doing a very effective lobbying job on Capitol Hill. I think they had a lot of trouble coming together with the Medicaid proposal. It's been, I won't say largely ignored, but it certainly has not been adopted in toto. And I have not seen any movement to change anything when it comes to the clawback, as unhappy as I know the states are about it.
It would seem that the business community would be a strong player in the process, and maybe even trying to shift some of the healthcare financing burden away from themselves onto the taxpayers. Where do they stand in this whole process?
The question is, where does the business community stand? Actually, a piece in Congressional Quarterly, for which I used to work a couple of months ago, had a big sort of story about how everybody really hates the healthcare system, and isn't it time for us to do something dramatic? And again, citing what's going on with GM, obviously spending more money on healthcare than on steel. A lot of companies, with Walmart trying to provide some healthcare, but not trying, but they have too many people who would be too expensive and would lose many of their profits if they actually provided full health benefits to everyone. The business community and the small business community is obviously disproportionately hurt because it costs them more money to get health insurance. The story made me smile because I wrote exactly the same story in 1991 when we were in almost exactly the same place, which is the business community screaming bloody murder about how much it was spending on health care. In fact, the insurance industry was in favor of universal coverage. After all, if there would be an insurance industry still, they would have more people to cover, and they were worried about smaller insurance companies cherry picking off the healthy population so that the good citizen insurers were being left with basically all the bad risks. And we basically had all the stars lined up in 1991 ready to do it, and it didn't happen. I mean, if you want to, I don't know whether you blame Bill Clinton or the Congress or Hillary Clinton or whoever, but that was about as strong consensus as I think I've seen for healthcare reform. So I'm kind of taking this one with a grain of salt. I see how unhappy everybody is. Governors are unhappy, business is unhappy, consumers are unhappy, the healthcare industry itself is unhappy, doctors are unhappy, but I just don't know how we get past this one-third, one-third, one-third in terms of where we go from here.
It's encouraging to hear you say that you think that the issues around the healthcare system are on the rise on the political agenda. Are there members of either party in Congress that you could name that we could encourage to have the courage to frame this dialogue and this discussion for the nation?
Well, I think we're already starting to see that. I mean, Republicans have interestingly become more active in healthcare. When I first started covering healthcare in the 1980s, you had, some Republicans who were sort of into healthcare. Senator Durenberger from Minnesota, Congressman Gradison from Ohio. They were sort of the healthcare wonks. And all the other Republicans, this is not a voting issue for our people, just pretty much ignored it. I think when healthcare reform came along and they defeated it, they decided correctly that if we don't want to have national health insurance, we better come up with alternatives. And that's how we got things like medical savings accounts and now health savings accounts and association health plans and all the things that are now being pushed on the conservative agenda. They haven't been able to really get those through because there's so many institutional blocks to those things, like the insurance industry when it comes to association health plans, that it's been hard to do, but we've basically just sort of clogged up things all the more. The Democratic Party, I think, does mention health care. I mean, all the Democratic leaders mention it all the time because it's always been a core issue for the Democrats, although these days you just get a sentence where they talk about minimum wage, health care, gas prices. I mean, they're sort of blocking it all together. It's hard to know who's going to really emerge, as the leader in the Senate. Obviously, Ted Kennedy has been the leader forever, and I think as long as he is there, he will be looked to as the leader. Hillary Clinton, who has, I guess, a tarnished reputation on this, but is still active. She's on the Senate Health Committee with Kennedy, doing a lot of work. In the House, Ways and Means Committee Chairman Bill Thomas is one of the big thinkers for the Republicans, always has been. Interestingly enough, since he's become the chairman of the Ways and Means Committee, he's gotten a little timid, although I think he would not like that word. He hasn't gone so far out of the box. So I'll be interested to see what happens when he is no longer chairman. Whether or not he leaves Congress, I don't know, but I'll be looking to him for some ideas. And interestingly enough, Newt Gingrich, the former House Speaker, who has now founded something called the Center for Healthcare Transformation, who has some really, really interesting ideas. A lot of them very bipartisan. He appeared with Hillary Clinton this summer, and they agreed on a lot. I won't say everything, but there are people thinking about it and looking at it. It's just, I think it will take, I don't know what it will take. I would say it was going to take a presidential candidate to put it back at the top of the agenda, but we tried that and it didn't quite work.
That was a great lead-in. I was going to ask you what you thought about all the buzz with the health information technology. I mean, it does seem to be a unifying issue. Newt and Hillary are on a roadshow talking about it, and the Secretary recently appointed a new commission. So I wondered if you could share with us, from your perspective, is anything going to happen out of D.C. in a reasonable period of time?
The question is about health information technology and whether anything's going to happen out of Washington, basically before everybody starts doing their own thing. I think that's the concern whenever, I talk to David Brailer, even Secretary Leavitt, who takes this issue very seriously. It's one of his top issues. And I think that, they know that there's a window where most health systems and certainly most doctors don't have electronic medical records yet. And there's a lot of concern that as people rush out and do them, they won't be able to talk to each other, and then we're going to have to retrofit, and that's going to be way more expensive than building it from the ground up. But as you also point out, this is a negotiation where there's business at the table, and there's the software makers and the hardware makers and the health policy leaders, and they speak a language I certainly don't understand. And I don't know how fast it's going to happen. So it's something I'm watching. Congress wants to act on this, but I think they've been told sort of quietly, please hold off, because we're afraid that you will cement something into place that we may not want. So I think there's a lot of interest, but they're sort of holding their fire, waiting to see what's needed.
What can you tell us about the involvement of the National Library of Medicine on that initiative? Starting now in November 16 and 17, there will be a symposium, DC, chaired by Mr.
Doug.
Image, that will touch this issue, informatics coming to the consumer through CBOs around the country.
Actually,
Can you tell us something about
I can't. You're telling me for the first time. But the question is about, yes, something that the National Library of Medicine is doing on health informatics.
The librarians are doing a great job to bring information to the public, the minorities, especially Latinos in the border and the rest of the people.
That's something I'll look into, what the librarians are doing.
Condi versus Hillary in 2008. Who's going to win and what kind of health program will they produce?
Well, I'm at a bit of a disadvantage because the question was Condoleezza Rice versus Hillary Clinton in 2008, sort of the dream ticket or the nightmare ticket, according to some. I have never heard Secretary Rice talk about health care, so I honestly don't know, although she's from Stanford, so they've got... it would be interesting. That would be fun. I think that's fair to say.